Guys, let's move on to pathogenesis of Salmonella typhi. Whenever we are talking, we usually talk about these four only. So don't think that it is the entire Salmonella we are talking about. We are talking only about the enteric fever causing Salmonella, that is Salmonella typhi, Salmonella paratyphi A, B and C, that is paratyphi A, paratyphi B and paratyphi C. All these will cause enteric fever. Now what is enteric? Anything that is related to the intestines. Okay, got it right? Now this is transmitted by oral route. So if you possibly consume food or water that is contaminated, you might get typhoid. Now these are the bacteria and they will go and affect what? Your intestines. Okay. Let us look at the risk factors now. Who and all are susceptible to typhoid? See, people who have less acid in the stomach. Why? Because the acid has to kill the bacteria, but if there is less acid in the stomach, the bacteria can reach the intestine, correct? Now when who has less acid in the stomach? An infant or a person who has taken antacid. So that person is risking himself to typhoid. Now one more thing I forgot in the previous slide here. Infective doses minimum 10 power 3 to 10 power 6 are needed. Okay, so 10 power 3 means what? 1000. You need at least 1000 Salmonella bacteria to come into you. Okay, 10 power 6 is again 10 lakhs or something, I think. So that much is required for, just remember, at least 1000 bacteria should enter you. Okay, so we are moving on to the next slide here, that is risk factor. Now risk factor, we told you, if there is less acid in the stomach and intestinal integrity. Now that the bacteria reached the intestine also is not, intestinal integrity is not there, right? It's not integrity, it should be integrity lost. Like inflammatory bowel disease is there, any prior GIT surgery is there, the person is on antibiotics, so the normal intestinal flora is suppressed. So all these things can cause typhoid. Okay, enteric fever. Typhoid is a type of enteric fever. So let's move on now then to the next slide. Now how does the Salmonella enter or invade? How do these bacteria enter our body? So now what happens? It is going to enter through the epithelial cells or the M cells. Okay, and they are uptaken via bacteria mediated endocytosis, BME. Just learn more about these. So the first step here, entry through epithelial cells, M cells, lining the intestinal mucosa. These epithelial cells are lining the intestinal mucosa. The Salmonella trigger the formation of membrane ruffles on the cell membrane of M cells. These ruffles reach out, enclose, and they take in the bacteria within large vesicles. So the epithelial cells, the cell membranes, they ruffle and they reach out, they enclose the adherent bacteria and they uptake the bacteria. This is bacteria mediated endocytosis. Now what happens? The bacilli, they remain in the vacuoles of the cytoplasm. Okay, let me write here. After the endocytosis, their bacilli remain in the vacuoles of cytoplasm. Okay. Now what will happen? Macrophages have to come, right? Now these epithelial cells which are containing these vacuoles which contain Salmonella, they reach submucosa. Okay, here what happens? They are phagocytosed by the macrophages. Now these macrophages come in now and they are trying to dissolve these epithelial cells which contain the Salmonella bacteria. Now these Salmonella are very smart. They go and start surviving within the macrophage also. Okay. But the Salmonella survive the intracellular killing and they survive within the macrophages also. Till here have you understood? So the Salmonella actually is very, very smart. See how smart they are, right? They enter the blood, they cause bacteremia, transient primary bacteremia, Then they disseminate through the reticuloendothelial tissue, that is the liver, spleen, lymph nodes, bone marrow, and they even reach other organs, gallbladder, kidney, lungs, etc. Okay. Secondary bacteremia occurs from the seeded organs. Okay. From these organs again it goes back to the blood and causes secondary bacteremia. Please get up if you are sleeping. We are talking about primary bacteremia, and then it goes to the organs, gallbladder, especially it loves to divide in gallbladder because it loves bile. Okay, it goes to gallbladder, liver, lungs, kidney. Okay, liver, gallbladder, kidney, lung, it goes to all these places. Okay, and then it causes secondary bacteremia. Okay, is this much clear to all of you? Very good. So this was the pathogenesis. Let me tell you finally what it causes. It causes enteric fever like typhoid and paratyphoid. Paratyphoid and typhoid are types of enteric fever. Typhoid is caused by Salmonella typhi. Paratyphoid is caused by Salmonella paratyphi ABC. It causes septicemia, gastroenteritis. Okay, shall we move on now?